This session covers how pharmacists and pharmacies get paid and how they can increase revenue for the business. We'll cover salary, indirect revenue streams, incident to billing, procedure codes, credentialing, and documentation of clinical services. How do pharmacists and pharmacies get paid? Staff pharmacists are typically salary or hourly if their floater is between multiple locations. A reminder from session 5 that a pharmacist salary ranges from $126,000 to $164,000, with the pharmacist working in physician offices earning around $142,000 on average. Looking to how a pharmacy owner gets paid, a pharmacy owner is a business owner. Margin left over after all their operational expenses leaves the pharmacist owner, which averages around $172,000 for the year. A definitive increase from the staff pharmacist salaries, but questionable if it's worth the extra hassle of owning a pharmacy and having little control over reimbursement for your dispensing of medications. If you remember losing money on 70% of prescriptions we mentioned before. What about a pharmacist in a primary care type role? The provision of pharmacy services has the potential to contribute both directly and indirectly to their institution's bottom line via direct billing and return on investment opportunities. In many settings, pharmacists can bill for services provided in an ambulatory setting, though allowed billing codes vary by state and location. While being able to show direct revenue associated with pharmacy services is impactful, reimbursement for pharmacy services is sometimes limited by lack of national recognition as independently billing providers. As a result, pharmacists are often paid salaries and look to contribute to indirect revenue streams, such as value-based care contracts and reduction of healthcare utilization. For example, studies in the past have found pharmacists can offset costs to the healthcare system by over $1,000 per patient and can generate revenues for the primary care practice that are 38% over the cost of the pharmacist's salary. Incident to billing is another strategy to allow non-physicians to provide follow-up services under the direction of a supervising physician and bill under the doctor's NPI, resulting in a greater Medicare reimbursement rate. Properly training your team about the ins and outs of incident to billing can help your practice bill services in compliance with these complex regulations. Furthermore, proper training and understanding of guidelines for all payers may help mitigate the risk of audits, legal challenges, or fines. But carefully adhering to incident to guidelines and rules, follow-up services provided by a credentialed non-physician can receive 100% of the physician's fee schedule for the Medicare instead of the lower fee. In order to bill a service as incident to, CMS has several requirements, including that only established patients seen by a credentialed non-physician provider for a follow-up appointment can be billed as incident to. The supervising physician must be present in the office suite when services are being rendered by the provider. The supervising physician must actively participate in the course of treatment. The medical services must take place in a non-institutional setting, or for example, place of service code 11. Both the provider and the supervising physician must be credentialed by Medicare, and the provider must be an employee of the supervising physician's practice. Incident to billing is not consistent with the CMS rules if the patient is new, an established patient presents with a new medical complaint, only one provider is credentialed by Medicare. For example, the physician is credentialed, but the other provider is not, or the supervising physician is not present in the office suite. In some situations and locations, pharmacists can bill directly for their clinical services. One recent example that began on March 1st, 2024, is Pennsylvania Medicaid made pharmacists mid-level providers and therefore able to bill for clinical services under their scope of practice. Here are a few of the services they can now bill for, but if you search for Pennsylvania pharmacist provider status, you'll find the full list of clinical services they can now bill for. The list is 13 pages long and includes services from A1C testing to vaccines to evaluation and management of a patient. Some private payers also allow pharmacists to bill directly for their clinical services. Here's a list of commonly used billing codes and reimbursement rates that a pharmacist EHR company called DocStation allows community pharmacists to submit for reimbursement from their private payer partners. I'll talk more about DocStation in a few minutes. Pharmacists have to be credentialed, enrolled, and contracted, just like physicians, to bill insurance. Pharmacy credentialing is the process performed by third-party payers to verify the validity of a pharmacist license and to ensure that there are no impending violations against the provider. Substantiating pharmacist credentials is an essential component of acceptance into a provider network. For example, health insurance providers, Blue Cross Blue Shield, Humana, UHC, will verify the credentials for pharmacists, which include having obtained a pharmacy degree from an accredited college of pharmacy and state licensure issued by the State Board of Pharmacy. Validating credentials is necessary to obtain reimbursement for services provided for their members. Pharmacist medical credentialing provides reliability and trust for the practitioner. Pharmacist credentials allow patients to trust in their pharmacy provider as well. As patient care services expand and reliance on pharmacists as healthcare providers increase, the need for verifying pharmacist credentials also increases. Enrollment is the process in which a provider registered with the health plan provider network. Pharmacists have to do this too. Enrolling in a health plan provider network allows the pharmacist to join a list of validated healthcare providers and hospitals with whom a plan contracts to provide healthcare services to the members within the network. The health plan's internal claims processing system will verify the identity of the healthcare provider to make a payment determination once a claim for reimbursement is submitted. The final step for qualifying for billing is contracting. Contracting is the legal process to establish a relationship between a health plan and a provider. This occurs once a provider is credentialed and enrolled within a particular health plan's provider network. Contracts typically include information such as terms of participating in the provider network and reimbursement rates. Documentation of clinical services as a pharmacist requires a similar software to an AHR, like Epic or Cerner, for sufficient enough documentation to be reimbursed for clinical services. In a clinic or physician office, the pharmacist can use the same EHR the site uses. For community pharmacy, there are limited options because it's a very new space where pharmacists haven't traditionally been able to bill for their services. One of the leading softwares for community pharmacy right now is DocStation that I mentioned earlier. They provide the documentation platform as well as contract with payers and assist pharmacists with their credentialing and enrollment. This session covered how pharmacists and pharmacies get paid and how they can increase revenue for the business. We covered salary, indirect revenue streams, incident to billing, procedure codes, credentialing, and documentation of clinical services.